Hello, this is Dr. Nancy Trimbley with Your Healthcare Arsenal podcast. This podcast is designed for that person who knows there's a better way towards health and wellness. They just don't know what that better way is. And my hope for you is that with each passing episode, you get closer to being your own best expert. Today we have Dr. Catherine Murphy, who is a holistic orthodontist. And I have to admit, when she and I were first conversing via email, I was like, I had no idea there was such a thing as holistic orthodontics. And I knew about holistic dentistry, not a lot, never experienced it myself. Um, but what's interesting, as Dr. Murphy and I were talking before we press record, she is on a parallel journey to me. She's been working one-on-one with patients for years. We'll find out how long. And now she's gotten to the point where she feels like her message needs to be heard to the masses. So she's been out there on a speaking network, a teaching network. She has her own community. So I invite you to join her community when you're done with this podcast. So, hi, Dr. Murphy. How are you
Hi,
today?
thanks for having me. I'm excited to share with your community, so thank you.
Well, let's jump in. What is holistic orthodontics?
Well, so here are some other terms because I understand that sometimes the term holistic can hold different mindsets for different people, especially when it's combined with another term, orthodontics, that they're already have a certain mindset about. Like,
Yes, we all had
oh,
braces.
we think about braces, and it's very interesting to me what certain people think of braces and how that's changing so much now too. Because now, before, like my generation never would have thought clear aligners, right? And now that's drastically uprising. So even children, like young children, are sometimes having the option of clear aligners. So we've got a lot of changes there. So holistic approach, it's also, I like to call it patient-centered approach to orthodontics. Some people, when it's in regard to dentistry as a whole, might be used to hearing more functional based, biological based, or airway. So
Airway.
yes.
Ah,
Now, when I talk with people, the reason why I chose holistic is because of the whole person, and that really the mouth is the mirror of one's overall health. And orthodontics is so looked at as just straightening teeth and like an aesthetic concern. But really, my specialty is growth and development.
wow. Okay, mind blown. All right. So just keep going. I like this.
So I like to share so that people can have an idea of what it requires to be an orthodontist. So can I kind of
Oh
help with
yeah.
that? Okay. So all orthodontists are first dentists. So we go through our college, we go through our 4 years of dental school, then we apply for residency. I chose to work for 2 years as a general dentist before I went into orthodontic residency. I actually wanted 5. But let me
Wow.
tell you, I knew what specialty was right for me, and orthodontics was right for me.
So
So I,
even though you knew that, you felt like, let me get my feet wet in the field.
yes, because there's so much.
Yeah.
So as an orthodontist that does whatever you want to consider with braces, we do dentures. We've done extractions. We've done, the scaling and root planing, the deep cleanings. And I'm like, oh my gosh, I would never do a denture. I'm
You
like,
just,
oh,
it wasn't your
and
thing.
well, because I'm like, oh, to learn all this and then I use it. So I went and I used it. There were also some personal things, as to just things in my life that led to me wanting 5 years before going back to school.
So is that what you ended up doing, or no, you only did 2?
I only did 2 because then
Uh-huh.
personal things changed.
Uh-huh. Right. Okay.
But I'm very happy, and I wanted to do some general dentistry first. So every orthodontist that works on you has done extractions, has done root canals, has done what your family or your general dentist has done. But then we go back either for a 2 or 3 year residency program. Its focus, because we're looking at jaw development, is growth and development. So we go back through and we relearn embryology. We redo anatomy. However, residency also has to teach you for what your patients are going to ask you for. And patients have been trained to ask the orthodontist to get straighter teeth.
Okay.
Right?
Yes.
So even though we get trained in what might be called early intervention or interceptive orthodontics, basically treating at a younger age, the majority of people are still going to be asking for us to treat teens or adults. Mm-hmm. Also, something that's really important that's overlooked even in my own profession, people forget that almost any school that has an orthodontic residency, so the orthodontics braces, also has pediatric residency programs. So those that specialize in kids, they also need to learn about doing some earlier orthodontic treatment. So just like you probably had a struggle finding patients to come to your chiropractic school because they're coming in being worked on by students, we have that. And we have to share the orthodontic patients not only with the undergraduate, so the general dental, we go through a course in our general dental, our 4 years of ortho, and we all have to do a case. So we need patients for that. Mm-hmm. We need patients for the orthodontic residents, and we need patients for the pediatric residents.
So you have to rely on people coming in that say, sure, you're a student, you have zero experience. Here's my baby.
Yes. So our training typically, even though we learn growth and development, and my own organization, the American Association of Orthodontists, actually says you should take your child to an orthodontist at the first sign of a malocclusion or by age 7.
So malocclusion, what do you mean by that?
So that's a bad bite. So how a bad bite might represent is either really crooked teeth, or with kids, just no spacing in the teeth between. They look more like my teeth.
So it's like at maybe 3 years old, you might start to see this kind of thing.
3 or even sometimes 2.
Even 2. Mm-hmm.
Now with my training, I can see it in babies.
Wow.
I don't then treat the babies. I'm just someone to help relay the next step of care. Mm-hmm. But oftentimes, again, even within dentistry, so your family dentist, your general dentist might say, oh, your child doesn't need to be seen by an orthodontist until 7. But that part of at the first sign of a bad bite, which also bad bite might be like the teeth might be really flared out, or the teeth don't come together at all. So they're like this,
That's
where you
what
can
I'm
have
thinking.
space, where the tongue keeps going through, or where you don't see the bottom teeth at all and you only see the top teeth. Mm-hmm. Or the lower jaw can be just really far back, and you look at your child's profile and you're like, oh, where's their chin? Or their chin can be really far forward, and you're like, wait, I'm not seeing the top jaw really out far enough. Mm-hmm. However, again, most orthodontists, we are not trained necessarily to treat that young. Okay. Right. We're trained, but we don't get as much experience. And there's all kinds of different reasons, behavior wise with patients, behavior modification. So typically most orthodontists aren't going to say, oh, they should have come in sooner than 7 because
they don't want to deal with a 2 or a 3-year-old.
Yes. Because again, it was the pediatric residents that got that training. And the reason why I'm saying this is because a lot of what I say stirs up the conversation between the caregiver and the orthodontist sometimes. Because
so mom says to the orthodontist, why didn't you tell me?
Yes. Or tells the general dentist, and the general dentist is like, yeah, but I've sent patients before, and they put them on a recall where they're going to just see them every year until the problem gets worse.
Until the problem gets worse and the kid can sit still.
Yes. And I will say, because I speak from this, as I was trained this way, I treated this way, right? When I first got out of school, I was able to work with a pediatric an ortho department office. I was head of the ortho, and I got to work with great pediatric dentists. so we communicated, but then like certain things I'd be like, oh, well, so what can you do on your end?
Right.
Because again, comfort level and having to shift that. And just like with every profession, we have to not stay comfortable. Um,
Right.
but the systems that are in place in most offices work really
Right.
well with age 7 and above.
Right. I hear, and
So,
we have a similar thing with chiropractic because chiropractic is super important for infants,
yes.
newborns, babies, and it's the same thing. It's growth and development, and it's proper neurological function, and being able to develop normally, whether it's brain
Hmm.
function or body function. But a lot of chiropractors just don't see kids.
Yeah.
And people, people will say, "You just adjusted a baby? Like what?" And
Hmm.
be like, it's a lot different when you adjust a baby than when you adjust an adult. It's a lot different because they have this image in their head of this horrible rack'em crack'em thing. Um, but anyway, yeah, so we have a similar thing in chiropractic where
Hmm.
if all infants could get checked,
Yes,
or as they go through their milestones, if they could be checked,
of
we
course.
would probably prevent a lot of
Hmm.
unhappiness and illness and disease and all kinds of stuff. So, yes, we are in a similar circumstance.
Which is very interesting because I actually really love to compare dentistry and chiropractic care because oftentimes once someone has an idea of what chiropractic care is, or what someone has an idea of either orthodontic or like general dental care, it's like, oh, you need to go through the process of unloading that because you're missing out and it's just really a barrier. But that's something they have a lot of other things to unpack with that. And it's more of that fear of what someone else has told them.
Yeah.
So it's like when my kids got their expanders in, which expanders are a device that goes in the mouth to help widen the jaws. I was very careful in how I wanted to let the teachers know and even family. I'm like, this is a positive thing. The kids are excited. They've been excited for this. And I didn't tell them about it coming, like any surrounding family, until I got them in. I made sure they were comfortable. My sons, we called it a sports piece. My daughter, it's mouth jewelry. And I let everyone know this is positive. They are happy. They are like this. They did a great job. If you have concerns, talk to me, not to them. Same
Right.
thing with
My
chiropractic
gosh.
care. Like my kids, at first they're like, why are you taking a kid? Especially my daughter who's 3 days old. I'm like, not your problem, not your party, not your problem. Trust me. Like it's my kid. Don't share your stories. And having people, because this goes more in depth, but oftentimes people that have that fear, they feel like if they share their story, it's somehow they're releasing the fear. Instead, it's just perpetuating
It's
it.
just perpetuating. Yes.
And it's like, listen to podcasts like this with Dr. Nancy, and then you won't be so scared of chiropractic care.
Yes.
So, yes, just like with dentistry, we need to see babies earlier. In dentistry, we're having a struggle to get babies to be seen by their first tooth or by age 1
Oh,
because,
wow.
again, most dentists don't feel comfortable. Your profession, you're having struggle to get people to see babies. But
Right.
also, I say if you don't want to see babies, just don't discourage it. Don't
Have a
say, oh, they don't
referral
need to be seen
source.
till 3.
Right.
Just say you see them at age 3. And then
Right.
you find someone that will see them beforehand.
Yes.
For like for both, for whatever it is, treat who you like. If you those that only want to treat adults, do adults. If you only want to treat kids. But then don't discourage others
No.
from working with the other population.
Exactly, because we're all the same family. I know for us in the chiropractic field, we're pretty tight and
Oh,
we
good.
kind of have an idea of what other chiropractors are doing. So if somebody isn't responding but to my care, but I know it's a chiropractic issue,
Hmm.
I'll refer out to other chiropractors so that they can get the help that they need. Because I don't know if this is true in orthodontics, but there is dozens of different chiropractic techniques. Dozens. I know 12 and you can't proficiently know all of them.
Hmm.
So tell me about growth and development as related to what you do.
Okay. So when I see the bad bite or the crooked teeth or the space teeth, which again, the fancy term would be malocclusion. Okay. That's really just a symptom. The crooked teeth are not the problem. They are a symptom of an underlying cause. Most of the time, because I try to shy away from saying always or never, but most of the time it is related to how the patient is breathing.
How the
Usually they
patient
are,
is breathing.
yes.
Okay,
I
go
just had this
ahead.
conversation at my brother's birthday party with one of one of his friends. She's like, "Oh, you're going to turn me into a mouth watcher." So here, everybody on this, I would love to turn you into a mouth watcher. I'd love for you to watch how your loved ones, if they're adults, kids, eat, how they drink. If they take a glass and they bring their tongue here, it's not going to be as exaggerated.
I could tell.
Something like that. Or if they're chewing and they chew with their lips apart, if you can hear someone chewing across the room, very audible sign that they are breathing while they're eating. Okay. So those are some of the easiest ways. Or if a child is really messy when they're eating, those are some of the simple signs of looking for common mouth breathing. Other things, watch how your loved ones are when they're watching TV or reading a book, doing homework. They're in a relaxed state. If they're like this, they can have their lips just a little bit apart. Some might have them really far apart. And I want you to think about what is happening to the muscles and the face and where the tongue is. And a simple exercise is that mouth is open. It's great that we have the back way. Like if you can't breathe through your nose, it's great that we can breathe through our mouth, because one thing in common is we're all breathing if you're
That's
here.
right.
But we can breathe incorrectly. And most of us do.
So I would have thought it was the other way around, because this is my chiropractic brain, a misalignment of the jaw would affect the breathing. But you're saying the actual breathing, is it a habit then that starts?
So mouth breathing in itself is also just a symptom of other
Oh,
underlying causes. So
okay.
you're on track, because that's very much part of it. Getting to, and I'm fast forwarding a little bit so we can back up, but I am speaking much more boldly because of the help of, practitioners like you that help me realize that at the core, it is a nervous system problem. And
Wow. All right, hold on. I just got the chills. I got a break. Okay. Okay, I could talk again.
and it goes back to why this is so interesting and it never ends. And then we could talk for hours about this, is because I even talk about how it's not just the child's nervous system. It is the mom that carried them, right? And so it could be a surrogate, but whatever nervous system habits passed on to the baby, right? How that mom handled stress while she carried the child, adopted mom, whoever carried the baby is going to affect that baby. But then whatever environment that baby is going into is going to affect that baby. And we live in a society right now that learning how to care for our nervous system is often misguided, misunderstood, and undervalued. So
I'm
my
writing that
approach.
down.
So another reason why I call it holistic is because, and I've gotten a lot more bold, that it truly doesn't matter how great of care that you might give them or I might give them, if they're going back to an environment where the parents or whoever they're living in the household, whatever that household environment is, if it's dysregulated there, how can that child learn to thrive if everything around that child, and we know the child development, they pick up on things, it has to be a whole family. Because especially when I first started, everyone's like, sign me up. I want wellness for my child. I want this. But they didn't want to make other changes, especially in their own lives, because it can be hard. It can be really difficult to look back and be like, oh, shoot, when I had braces myself and I had teeth taken out, but I also had allergies and all these things, and how many people missed it.
Right.
Because no child that comes into the orthodontist at 12 and had teeth taken out at 12 can fully blame that orthodontist, because at 12 years old, how many times should they have been seen by their primary care physician? How many ear infections? How many sore throats? How many colds? How many things had they been presented with, but never truly cared for?
Right. Right.
So at 12, you went in and your family asked for a straighter smile. Your jaws didn't grow. You saw the effects because of the ear infections, because of the tonsils, all those things. And you wanted a straighter smile. And they gave you a straighter smile. And they were part of the piece, right? But all those, you have to look at all the other providers too that you ask, like, hey, I'm getting these, airway issues. And you got put on Flonase for a
Right.
while.
Right.
You were put on Zyrtec every day because your pets live in the house. But then no one talked to you about air filters. They didn't talk to you about the plugins that were irritating the child. There's so many things that got missed, and it's not a blame game. And so once you realize that, shoot, no one really knew how to put the things together, and then understanding that, oh, like, you trusted these people and you might feel let down, but you have to understand that that's also not how the regular model of healthcare is set up. It's
No.
just not. So there's this whole unpacking when you bring your child in and your child has all these symptoms. But then if the family isn't willing to be like, oh, yeah, all that stuff happened to me and I want better, so I need to then address all these issues in myself.
Right.
But I'm sure you've seen this with your care too. Sometimes they still just I want the results of the holistic approach without any of the extra work.
That's so, you know what, that brings up such an amazing point that I feel helpless about as a practitioner, because okay, I'm clearing your nerve system, but I know that you're going to go back to your dad's house because you're his caretaker and he is schizoid, and he, and it just is going to send you back down again. Um for somebody to really look at their life, it's a lot, even to get rid of processed foods for some people is like unfathomable, like nobody's going to eat, or so it's so hard, but it's so true.
it it can be the biggest change to having harmony in the household when everyone can get on board and recognize that the problems that are seen are not just with the child.
Ah,
When they can let go of the blame game of, oh, well, it's the genetics of so and so, or oh, my great 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 grandfather had this and we're going to blame it all on him.
yep.
Until we see that in the United States, and I work with those across the world with my mentoring, the support is starting to really deteriorate for actually growing a healthy family dynamic.
Yes, I totally agree. So in this case, the child that has the crooked teeth, who has the underlying issues, is really a symptom of a dysfunctional household.
Oh, I guess it's being really bold about it, but let's make it a little bit softer. That the nervous system of the child and surrounding family members.
That's right. That's more correct. Yes, it's this dysfunction of the nervous system of the child that's a reflection of the dysfunction of the home in a lot of cases,
Yes,
maybe
and
not all.
that's a really hard pill to swallow because we're all trying our best. But if you take a look at like, oh, well, how are these interactions? How am I in the mornings? How am I in the evenings as a parent? And how is that reflecting to my kid? What things do I have going on that I don't want to let go of? A big thing is scents. Like from the clothes to the dryer sheets to the plugins to the candles.
Yes.
And for a child alone, that can be so triggering to them that that's going to cause inflammation in their body. It can also just dysregulate their nervous system to have just that much sensory overload of so many smells that are unnatural.
Yes.
But there's also that fear of, oh my gosh, if my house smells, what are people going to think of me? Or if my clothes don't smell like Gain is a huge one that advertises, it'll stay smelling this great for 12 weeks. I'm like,
What?
isn't that a problem?
Isn't that a problem? That's right.
So now when we get clothes either passed down, which I love hand-me-downs because there's so many clothes out there that then just go into the garbage. I love hand-me-downs. We go to garage sales. But sometimes I have to wash the clothes 5 times
Oh my gosh.
to
I
get the
believe it.
scent out. Because my kids, like, they will know. They're like, ooh.
Right.
Because once I learned how horrific so many of these detergents can be on our skin, which is our largest organ, to our nose, to our lungs, to inflammation. And that's a very simple thing. Because I'd like to make sure that anyone listening, you can do changes right now, like starting today.
Mm-hmm.
You don't have to go and throw away your stuff.
But you could.
But you could. And you
Mm-hmm.
could just start looking for alternatives.
Mm-hmm.
And you can just start, if you do the scented stuff for your washing machine, maybe don't do it for your dryer. Okay? Start decreasing that. If you have the Glade or Bath and Body Works plugins, try a nice diffuser.
Try to get true essential oils. Just get
Yeah.
essential oils. Yes. Mm-hmm.
You know, you can, the holidays are coming up. You can ask for those like as a fun gift. Just take those steps, or just unplug them for a day and see how it is. Open up your windows and get the fresh air in. And that can make a huge change, because also bringing air into your home, it can just bring a whole other feeling and calm to your household. Bringing outdoors in, because we spend so much time indoors.
Yes.
So I know most people are like, you should be talking about straight teeth, but those are
right.
The other thing is, once you do treat and once we get the growth and development, it needs to be maintained. Mm-hmm. And part of that maintenance, it's ongoing. Like, you don't get to just be done, just like you're never done with chiropractic care. Right. I mean, you're not going to be like, oh, bye, I don't need to see you for 10 years.
People do.
They do.
People do. But yeah, they shouldn't. And I always tell my patients, it's a choice. It's a healthcare choice. Mm-hmm. Like, if you want to eat Doritos every day, or if you want to eat broccoli and kale and cabbage and whole foods, that's your choice. If you want to continue with chiropractic just to maintain and keep everything humming along, it's your choice or not. Yeah.
I'm going to share a little story. I had someone talk to me about how, like, gosh, how often do your kids go see a doctor? My goodness, when are you going to have to stop having them go to the doctor? And we use doctor as a general term. They're in speech. We have an energy practitioner who is actually who connected us. Isn't that who connected us? Amy Allen?
Yes, it was Amy. Yes. Oh, I just was chatting with her today on text. That's so funny.
So, we call her a doctor. We call the craniopsychotherapist going to a doctor appointment. Everything's a doctor appointment because it's just easier for my kids, right? I'm like, well, I'm teaching my kids that you go to stay healthy, because I'd rather keep going when we're healthy. Or, certain things like, oh gosh, I'll message like Dr. Amy and be like, okay, I noticed this with my kids. Can they be seen sooner? But why don't we maintain this like positive, so then they like going? Like, I had my daughter once ask, when will I see Miss Angie again? I'm like, I'll call her. I'll find out. And I trust that she recognizes then what her body needs, And
Yes.
at her young age, that's how she communicates it.
Yes.
So for me, you can see a doctor only when you're sick. But then what happens later on is that then you get in this perpetual only seeing when you're
Only
sick, and it's
sickness. Right.
continues to only treat the one thing that you come in there for,
The
and
one
they don't look at
symptom.
all the other things.
No, they don't. That's the conventional model. It
Yeah.
treats the symptom or the diagnosis. Whereas holistic practitioners like you and I, we keep the body functioning normally. We keep it
Mm-hmm.
optimally functioning so that the hope is that you don't fall into the trap of disease or illness. But yeah, that's proactive.
Mm-hmm.
And the conventional medical model doesn't recognize that because there's no diagnosis. They can
Yeah.
only treat a diagnosis, not the
Yeah.
person. There's a lot of strength in that. So let me ask you this for myself, because this is all new to me. If I were to come in and see you, what would that visit look like?
Mm-hmm. Great question. So I I have a sleep questionnaire and an observation sheet. An observation sheet for adults, you'd be like observing yourself. Oh, like how often do I bite my nails, or how often do I like fall asleep while I'm watching a movie? So there's a whole list. Also a sleep questionnaire, but then those are kind of just jumping off points. I will ask anyone who will be comfortable enough. I try to read my patients. Some are not ready on the first visit to answer questions like, oh, so do you recall, your family ever telling you that you were able to be breastfed or you weren't able to be breastfed? And when I say breastfed, I mean like actually like fed on the breast and not with breast milk. Breast milk is
Hmm.
great through a bottle. Breast milk is wonderful, but there's a difference with the impact of the growth and development if it was on the breast or if it was breast milk via bottle.
Absolutely. Hmm.
And then if they remember things like pacifier, and they're like, well, why are you asking me stuff about when I was a baby? But it's all to then try to connect that from the very young age and to now, because sometimes we'll also be very quick, like, well, I I love hearing this. Well, of course I get up to go pee. I'm over 40. And
Mm.
it's like, oh, but that's just because you're
Hmm.
over 40 does not mean you should be getting up to go pee.
Right.
Let's also look at when you were a kid. So did you like move around a lot? Did your parents ever say, oh my gosh, we can't ever make your bed because the blankets are everywhere? So this has been a problem that's been going on for a while. So this isn't going to be just fixed overnight. And I get to work on the skeletal system. However, two other systems that have to be addressed to get this, stunning smiles because of having things work in harmony, you need to have your muscular system worked on and your nervous system worked on. And the hardest one is actually the nervous system because it may require numerous providers.
Hmm.
My go-to, so anyone that knows, like, I'm going to always recommend with orthodontic care that myofunctional therapy, which is basically physical therapy for the face.
Mm.
So we can talk about that a little bit more, but myofunctional therapy and chiropractic care.
Hmm.
With, again, the nervous system, then there's going to be others. We mentioned Dr. Amy Allen here. Um, I talked to her like as if it's energy medicine, she might want to be labeled something else.
Right.
But I have a lot of patients that then they understand that, or frequency medicine by
Right.
New German medicine. But
Yep.
that can help, anything that can help support that, because it's years of these habits that made you feel safe, and you need to retrain your brain. And thankfully, we have the neuroplasticity lifetime. We used to have these thoughts that neuroplasticity like ended at some magical age, but we
Right.
can
Imagine that.
change.
Hmm.
But it also has to be in an area that you feel safe, that you can rely on your nose to breathe on, that you can actually rely and change that habit of thinking you have to get up to pee, or that you can't drink water for 2 hours before you go to bed because you might have to get up to pee. Well, if you need to drink water, let's help you change that mindset that you can't drink any for 2 hours beforehand because then you'll have to get up. Like, let's work on getting you to that deeper sleep. so that your body doesn't want to get up, that your body's telling it, like, hey, you are going to be resting here for 6 to 8 hours. We're going to shut that system down. And that's where the connections need to be made of understanding, again, everything that shows up in the mouth is really just a mirror of what's going on elsewhere.
Oh my gosh. Wow. Wow. So you would assess a person and get that full history and see what they need. Chiropractic care, myofacial, which that's a new word for me too. I love it. And also you would be doing some work with them as well.
Mm-hmm.
What would that involve?
So it would be myofunctional. So myo, like,
Myofunctional,
yes,
sorry.
that's okay, but how the muscles work. And so depending on their symptoms, I listen to their TM joint, listen for that, look for history of that, look for compensations that they've made that maybe they had pain before, but now they just have lived with the pain and they don't realize it. So we talk about what their end goals are, because, and I'm going to put this out there because it's going to happen. More patients that are 40 and over are going to start looking at having jaw surgery.
Ah,
Right now, and I understand that that's the reaction from most, okay, because it's not very common right now. It used to be very common in the 70s, but now we can expand in adults, so we can make the top jaw wider. We can help upright the lower teeth with an appliance as well. There's some movement that we can get to have the jaws come a little bit more forward, but many people actually need both jaws to be more forward enough that they would need surgery. And the reason why I'm putting this out here, because depending on the age of your listeners, when you start to hear this happening more, it's because I'm 46. Us at 40 plus that are being put on CPAPs as a lifetime.
right.
A CPAP should be a bridge. CPAP can help you breathe, but it's not an end result. It's a ventilator that's putting you on. There should be then what other follow-up care are you going to get?
Right.
This is really just a Band-Aid. And one of the best things that's going to be out there, there's already things like appliances that will move your lower jaw forward at night, but actually correcting the jaws and having the jaws where they should have been. Which I will say, on the plus side, it gives you not only better sleep, better longevity, because then you don't have to be having this mask that pushes on your face and counteracting it, but it will also give this benefit of making our faces be how they should have been.
So you're saying this TMJ, this jaw surgery, is something that is a corrective thing, and that we will see more of that, and that it is a good thing?
Well, so TMJ surgery, looking at that separate from when I talk about jaw surgery, like orthodontic surgery, where they would actually bring the top jaw forward. Wow. In most of us, when you start being mouth watchers, if you look, in orthodontics, we focus so much on the lower jaw being too far back. Like I said, if you're like, oh, where's my kid's chin? But if we look, oftentimes we're too deficient also in the top jaw, because we haven't had the proper tongue posture to bring it, excuse my hiccup, forward enough. We haven't had the chewing, the food, the breastfeeding to help bring that top jaw forward. Wow. So our top jaw is too far back, and so is our lower jaw. Wow. So then it can collapse the airway, because again, the airway is just muscles. It's not a skeletal thing. So we can bring the top jaws forward, which brings the soft tissue forward, which then can increase the airway, which I will tell you, the bonus is that like we can get that face that we've wanted sometimes if we've had that retractive orthodontics, if we've had the jaws too far back. So you're gonna get the better airway. Then you also get, it's also has the benefit of aesthetics, because really anything that helps us feel better is going to help us look better. So I don't want to scare people. I want to put that out there, but also like, hey, there is that nice side benefit that anything that helps us breathe better is going to help us look better.
But there is also a range of other things that can be done. Yes, absolutely. I actually use one of those mouthpieces that
Do
brings my
you?
bottom jaw forward. Yeah,
Oh, good.
and I find that if I use it 3 nights in a row, it kind of trains my jaw to stay forward,
Hmm.
and I'll be able to not use it for a night or two, but then I have to, keep using it. But it does help. It
Oh, I'm
does.
so happy that that helps for you. It can be a really great device for those. You have to look at the jaw joints. There's so many things that your dentist looked at before they gave that to you. Um, and then if you'd like, since you're already, because of the work that you do, and you find that you're able to keep that jaw forward, I would suggest that you work with a myofunctional therapist. And they can
Yeah.
really help with that function of the muscles so that you want to stay there.
Yeah.
Because I
Yeah.
actually used to have a little bit of a slide. I used to like, but now because I've gone through and I've worked on my muscles now, I don't have that slide.
Interesting. Okay. Yeah, I'm gonna do that.
Good.
Yeah. Yeah. I'll get a name from you
Hmm.
so we can do that. So this has been a fantastic conversation, Dr. Murphy, and I learned a whole lot that I can add to my own arsenal so that I can help my patients. And I just have one final question
Hmm.
for you, and I didn't preview this one. If you had a billboard for all to see, what would it say?
Oh, goodness. That's a good one. Um, it would probably be something actually about self-care. I I feel so strong that especially for moms, not to leave you gentlemen out, um, but those that are in the maternal role, okay? Again, if we are able to take care of ourselves, we're able to take care of others better. And if we are able to do that hard work of actually figuring out what we need, because
Mm,
sometimes we haven't been taught to actually look at what we need. If we can figure out what we need, we will be better in tune to our children of what they need and not trying to always compensate and giving them what we wanted as kids. Let's give them what they actually want and need as kids.
hmm
So that'd be my billboard.
I love it. Self care. I love it. That's awesome. So, for all our listeners, this has been Dr. Nancy Trimbley with Dr. Catherine Murphy. This has been your Healthcare Arsenal podcast. And my hope for you, as always, is that with each passing episode, you get closer to being your own best expert. Bye for now.
Bye. Thank you.